if you ever saw Men in Black, where Will Smith takes the stick, and he says, "We're going to erase your memory." It was a complete career transition, and you have to be able to step into that discomfort. You have to be able to step out and accept a new way of thinking. There is a lot of gray area. As soon as he started lecturing, about 5 minutes in, I pushed pause and I looked at the person sitting there with me at Panera, and I said, I got to find out if this guy teaches a course or does something. This was a big discomfort moment. So the way I got here, the reason I got here was I started my career as a general dentist, which I still am, and found out I was pretty unhappy in general dentistry and had a decision to make. Either I just made a very expensive, very lengthy mistake, or there is something within the world of dentistry that I can leap into and feel like I could be happy doing. So I made the very uncomfortable and very hard decision to completely get out of general dentistry and to transition my practice 100% into TMD and sleep. That also wasn't an easy transition. I had done a lot of different CE events. Again, I kind of thought that I would just focus on airway. I thought I would just do sleep. I thought that seemed interesting and that's something that I want to do. And I went to all these different events, different people, different educators, different groups, and learned a lot of different things and really just couldn't fit it all together. And I happened to be introduced to the American Academy of Craniofacial Pain, the AACP, and I watched one single lecture, and it happened to be Dr. Stephen Olmos. And as soon as he started lecturing, about 5 minutes in, I pushed pause and I looked at the person sitting there with me at Panera, and I said, I got to find out if this guy teaches a course or does something, because this is wonderful. This is fantastic. And lo and behold, searched it, found TMJ and Sleep Therapy Center International in the Mini Residency, which was about 2 weeks away from when I found out that it was happening. And I was like, well, this is a no-brainer. I'm going to have to figure out how to make this work, and I'm going to have to go there and do it. And within sitting in that mini residency in the first hour, 2 hours, it was pretty immediate. I was like, this is it. This is putting together all of these things that I was going to try to have to figure out how to put together myself, all of these different puzzle pieces, and sat through the entire first weekend. And I think by the end of that first weekend, I was like, that's it. This is my home. This is my group. This is my family. This all, this just click, 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 click inside my head. And by the end of the third session of the mini residency, I had decided to become a center. I was a center. And, that was hard too, because, for me, it was a complete career transition, and it was just taking a big leap of faith to say, I really, truly, so strongly believe in the mission and in the work that I could do in this arena. And I just said, I'm just going to go 100% into this and figure out how to make it work, how to make it successful. And I was just so fortunate, though, to have TMJ and Sleep Therapy International and Dr. Olmos really mentoring me and just guiding me step by step and providing everything I needed, from office training to the educational part that I needed to the mentorship that I needed. So if I had a challenging case, I had somebody I could reach out directly to and say, hey, I'm a little stuck. I don't know what to do. So, that mentorship was invaluable. And then the training that they do for your staff and everything that they get you set up to go enroll in a practice like this, which is very different from dentistry because you're dealing more with the medical side of it. So while it was a tough decision, it was made so much easier by all the support from everybody at International, all the training, all the mentorship, everything that I got there. I think the biggest amount of discomfort that comes for most doctors is you have to turn off your dental brain and you have to turn on your medical brain. And that's a hard transition to make. It's almost Dr. Olmos always plays this video, which I find hilarious. If you ever saw Men in Black, where Will Smith takes the stick, and he says, "We're going to erase your memory," and he jokingly plays it at the beginning, because the fact of the matter is you have to you have to kind of forget everything that you've learned so that you can see this from an entirely different lens. And I think that is very uncomfortable. So I can definitely see the discomfort in doctors when they come and you're all of a sudden learning something that is so vastly different than what we've learned before. The other part about turning your brain off from the dental brain to a more medical brain is, in dentistry, we're taught things are very black and white. You either did the job right or not. You put the implant in well or not. You did the cavity well or not, right? So it can be a very black and white field. And when you're treating chronic pain and sleep breathing issues, there is a lot of gray area for success within that. And that can sometimes be very uncomfortable for dentists, because we have sort of been conditioned to say there is success or failure and that's it. But there are degrees of success when we're doing this work that, again, many people can find very uncomfortable. I think the biggest limitation for a doctor, if they're coming to the mini residency, if they just want to stay in their lane of what they're used to and what they're most comfortable doing, is then you're not going to be open to accepting all of the knowledge and the information. So by staying comfortable and saying, well, this is what I learned in, dental school 20 years ago, again, you're not staying up to date. You're not really able to open your mind up to all the different facets of treating craniofacial pain and sleep disorder breathing. We talked about earlier, with Dr. Olmos, had he just stayed comfortable and in his lane of just knowing dentistry, he would have never came up with this entire system. So you have to be able to step into that discomfort. You have to be able to step out and accept a new way of thinking and looking at things and treating and evaluating patients. Because if you can't and you just want to stay in I'll give you A device and we'll do B treatments and that's going to equal C amount of success, then you're going to struggle. Right? So you're definitely going to struggle, because you have to understand that there's thinking. It's not cookie cutter. This isn't for the faint of heart. So you have to be able to open your mind, accept new knowledge, accept new information, accept different ways of treating people than what we've been conditioned to in the past. So I think if it's somebody who's wavering of, can I step into the discomfort? Am I ready to sort of tackle an entirely new arena of dentistry and a new way of looking at, patients and treating patients in an entirely different subset of patients than we would normally be treating, is, the mini residency isn't set up so that it's a singular weekend. You get 16 hours of CE and the expectation is you go home after one weekend of learning and you're expected to be able to implement it right away. It's set up so that session 1 is all foundational. So we give you all the background information. What are you going to go home now and look for in your patients? And then we ask people, please bring back cases so we can go over it with you so you feel comfortable doing it. And then session 2, we go over, okay, now that you know what you're looking for, now that you have the foundation, now that you have the fundamentals, session 2, we come in and say, okay, this is how you're going to make appliances. These are the different therapies and the different things that you're going to use after you've had your diagnosis that you learned initially so that you can start treating this patient. And again, same idea. You go home. You have weeks in between so you can digest the information. And not only is it the information that you're digesting from what we didactically lecture, but you also get the manuals, which the manuals are huge. So imagine everything we've lectured on just in a significant amount more detail. I'm talking almost 300 pages per manual per session. So you're getting a ton of information. So that way you can reference back. And if you have questions or, maybe you wrote a note down and you're not sure what it says, you have all of this at your fingertips to go back. And if you're seeing a patient, you can reference the manual, right? So session 2, go home. Tell us, find some cases, start a case, come back to us, let us know what questions you have. And then session 3, how do we continue care? How do we, wean patients off of appliances? What does the next step look like? So you have all of those opportunities for support from us within the mini residency, for all of the information that you learn, not only in the courses, but in the manuals that you take home. And then, of course, for those that really want to dive deeper into it, is the opportunity to become a centaur and then get personally mentored by Dr. Olmos, myself, and the other center doctors as well.